We have two different packages here with two different types of foam. They have multiple foams. They have white foam, black foam, and silver foam. Silver foam is usually only for the inpatient. The most common is black foam. I'm going to open up this particular package first so that you can see what this would look like. We would like to keep all of our supplies on our clean area here. This was already a canister that I opened earlier, but new. We have the foam. You can see this is a foam that's a bit thicker, black foam. This is the washer head. You can see here. These are just taped. You can open these, discard this. We have this tape is called drape. The actual term is drape. And then there's a measuring ruler. What we need to do first is actually measure out the wound and see. A lot of this is arts and crafts. You can take the actual whole foam and actually push and see how you think this would best fit into the wound. You can take your scissors. Again, these scissors have to be cleaned prior to starting your procedure and as soon as you are complete. You can kind of see, play with it. Still too big. It doesn't have to be completely exact, but you do want to have coverage over your entire wound. You can see I have a gap here, which is okay, but I might want to recut another piece in order to not have these gaps. This area is a wound as well, and so we want to protect that with a different type of dressing. I feel like I want to recut this, so I will do so. And that seems to fit a bit better in there. You can make it slightly smaller. And it fits pretty nice in there and snug. You can err on the side of having a smaller foam rather than a larger foam in order to, once the suction occurs, it sucks all the edges together and it actually contracts the wound to be able to close it this way, okay? So this seems to be good. We also have this area here. I'm going to protect it with a alginate of some sort. I'm using this particular alginate and I will actually put that here for wound healing and to protect the wound. There we go. The drape, we have the drape like this. It comes with multiple pieces. And what you want to do is first window pane around the actual wound. When cutting strips, you want to cut in strips this way because you need the tabs in order to actually use the adhesive. Because this is long for the wound, we can cut this in the middle in order to have a more manageable size. Once again, we want to strip around. So I'm going to make 4 strips right away. To go across the 4 sides of the wound. There are numbers on here. 1, 2, and the 3rd is always this blue tab. So for number 1, we will actually remove number 1 this way. Again, you want right now to create a window pane. I like to overlap the area, have a nice seal. You have number 2, you remove number 2 tab. And you have number 3. Oh, this is another number 1, and then you can take this way. We're trying to create, again, a window pane around the wound. You could have made this a lightly smaller, and it doesn't have to overlap onto the foam. Another one we will do. That was number 1. Here's number 2. And 3rd is the tab. I like to cut the strips ahead of time, so then that way you already don't have to keep going back and forth. You have something to work with on your field. Because there's a significant gluteal cleft here, again, you want to create a good snug fit onto the body in order for the seal to occur. We will show other techniques on how to close this gluteal cleft in another video. We're on number 2. And the 3rd tab. Now we've completed the window painting procedure to protect the peri wound. We do this so that the foam does not touch the good tissue. It is, number 1, painful, and it can hurt the good tissue significantly. So it's like sucking on good tissue, which is can create damage to that tissue. We then want to have one big piece over because we have to create the seal. So after the window painting, I think that this is probably a good size. We can probably do it this way, and we can always use more drape later as well. Number 1, I'm removing. Trying to create that seal in here, in that gluteal cleft. Number 2 here. And then the third, which is this tab. This roll, that's fine because we have to put another area because all of the foam has to be closed. I'm just going to use, again, another large piece, but you could choose to make strips to go 3 different strips. The reason it's better to use strips or smaller pieces is that if the seal is not there once you put the wound vac, then you can more easily find where the leak is. 1, taking the rest of the number 1 off on that tab. Again, pushing on all the edges for your seal as best as possible. Taking your number 2. Okay, my number 3. Now what's important here is that you now have to make a connection with the foam to the actual negative pressure machine. This is where the washer is, so we would have to position this where the tubing does not create more pressure. So we're choosing to put this way and have the wound vac maybe on the hip or on the side, but so that there's the least amount of pressure. There are techniques if we need to protect this area as well. We're going to show you how to do that. 1, you need to have a 1/4 size hole here, roughly. Now, if this is going on a bony prominence, if I put it here, and this is going to put pressure on the skin here, then sometimes what we can do is a bridging technique. So we can take the remainder of the foam and we can actually create a bridge so that this is cushioning the skin, okay? But again, this cannot touch good skin. You have to put more drape, okay? So I would create a small strip. And then 1 larger strip. The first strip is just to protect the skin. Because I'm going to place my bridge here. So I can bridge, and bridging can be, you have to do foam to foam. Foam to foam has to touch, okay? Technically, I would have liked a longer piece here. So, because we have to touch the foam to foam, okay? But for the purposes of instructional, we're going to just show this. Our next piece now, you have to have foam to foam in order to get suction, okay? If you're gonna use more than one piece of foam, you have to have suction. So that foam is touching there. Remove number 2, remove your tab. Now, I can make a hole here. I could technically even make a hole here if we wanted, but we actually want to put the washer here. But if this is causing pressure also, sometimes we have to move the washer somewhere else. The patient is sitting, and then what you can do is use that bridge technique and place the washer somewhere else on the actual block bridge, okay? We're going to show it here for now. And we're just using the bridge as a little bit of a cushion right now, okay? Here also, there's numbers, you remove them 1. This says 2. And then your last one is usually the blue tab. Okay. Ensure that this is open so that you don't clamp down your tubing. This is open. You have the canister. The kit that this actually has a cap on it. You can remove the cap. These 2 things connect them like that. Have a good connection. Both my clips are open. And now this goes into the wound vac. And you turn it on and the suction will start and push this all down.